Cardiologist warning morning habits. Heart attack risk. That 25 to 30-second morning mistake. A deeply concerning reality for many individuals over the age of 60 is the potential danger lurking in the very first moments of their day. While a lack of adequate sleep is often implicated in health concerns, new research points to a far more immediate and insidious threat, a specific morning habit performed almost unconsciously by millions, which can dramatically elevate the risk of a fatal cardiac event. This isn't about long-term lifestyle choices like smoking or dietary habits. It's something that occurs before your feet even touch the ground, a seemingly innocuous action that your doctor may have overlooked. The gravity of this situation is underscored by studies revealing a startling increase in the likelihood of heart attacks occurring between 6 a.m. and 10 a.m., a phenomenon not attributed to mere chance, but rather to biological processes that are amplified by this common morning ritual. The detrimental effects of this habit become clearer when we understand the physiological changes your body undergoes as it transitions from sleep to wakefulness. During slumber, your body operates in a state of minimal activity, characterized by a slowed heart rate, reduced blood pressure, and a quiescent nervous system. This period represents the sole genuine rest your heart receives within a 24-hour cycle. However, the moment your brain begins the process of waking, even before your eyes open or your alarm sounds, your body initiates a surge of two critical stress hormones, cortisol and adrenaline. These hormones, which start their ascent approximately 60 minutes prior to full consciousness, are already at high levels by the time you reach to deactivate your alarm. This hormonal influx triggers an almost simultaneous cascade of reactions within your cardiovascular system. Your heart rate accelerates, your blood pressure escalates, and your blood vessels constrict, all within a matter of seconds. In younger individuals, this sudden hormonal surge is typically managed effectively by a resilient and elastic cardiovascular system. Arterial walls remain supple, allowing for instant adaptation to the increased demands. However, for those over 60, the physiological landscape is considerably altered. Arteries become stiffer, the body's response mechanisms are sluggish, and crucially, many individuals harbor silent, undetected plaque buildup within their vascular walls. When this hormonal wave strikes a blood vessel weakened by vulnerable plaque, the sheer force can cause it to rupture. This rupture, in turn, initiates the clotting process, leading to a potential heart attack if it occurs in a coronary artery or a stroke if it affects a cerebral artery. This is not a hypothetical worst-case scenario. It is a well-established biological mechanism that has been observed repeatedly. The increased incidence of morning heart attacks is a direct consequence of this vulnerability. The critical factor then becomes what you do in the immediate aftermath of waking, specifically within the first 25 seconds after your alarm signals the start of your day, as this can either assist your heart in managing this surge or push it beyond its capacity. Consider the case of Douglas, a 68-year-old retired school principal. Douglas was a meticulous individual, diligent in taking his prescribed blood pressure medication every morning, committed to a consistent walking regimen 5 days a week, and punctual with his annual checkups. His cardiogram results were consistently clean, and his doctor had assured him he was in good health for his age. Yet, one Tuesday morning, following his established routine, Douglas awoke, silenced his alarm, and promptly sat up, swung his legs over the side of the bed, and stood up. Tragically, he only managed to take 3 steps toward the bathroom before collapsing. His wife discovered him on the floor. Upon reviewing Douglas's case, his cardiovascular profile appeared to be that of a man actively engaged in maintaining his health. His medications were appropriate, his diet was reasonable, and his fitness level was commendable for his age. However, a crucial piece of information had been missing from his care: the significance of the first 25 seconds after waking. This oversight, which his cardiologist had never addressed, serves as the impetus for this vital discussion. The dangerous habit that silently loads the gun for so many individuals over 60 is the act of standing up immediately upon waking. The moment an alarm sounds, they transition to a vertical position in under 3 seconds. This action, which feels utterly utterly ordinary and insignificant, is in fact one of the most perilous things a compromised heart can experience at that precise time of day. The scientific explanation lies in gravity's effect on blood distribution. While lying flat, blood is relatively evenly dispersed throughout the body. The instant you stand, gravity pulls a substantial volume of blood downwards towards your legs and abdomen. Your heart must then react instantaneously to ensure sufficient blood pressure reaches the brain. In younger individuals, this reflex is rapid and precise. Blood vessels constrict, heart rate adjusts, and blood pressure is maintained within seconds. However, in adults over 60, this reflex is attenuated. Blood vessels respond more slowly, and blood pressure can experience a significant drop, sometimes by as much as 15 to 30 points, within moments of standing. This condition, known as orthostatic hypotension, is often experienced as a transient feeling of dizziness, lightheadedness, or a foggy sensation upon rising, and is frequently dismissed as a normal part of aging. It is, however, a critical warning sign. The danger of orthostatic hypotension is compounded by the morning hormonal surge previously discussed. When blood pressure plummets suddenly after standing, the heart's compensatory response is to increase its rate and output aggressively to restore circulation. In a heart that is already vulnerable due to the morning cortisol surge, stiffer arteries, and potentially thicker blood, this compensatory spike can be the trigger for a life-threatening event. It can precipitate an arrhythmia, fracture a piece of plaque, or, in the most severe cases, lead to a catastrophic cardiovascular incident culminating in a visit to the operating table. The act of standing up in under 3 seconds represents a critical 25-second mistake, one that carries no cost to correct and has profound implications for cardiovascular health. Adding another layer of risk to the morning hours is the pervasive state of dehydration that most individuals experience upon waking. After 7 to 8 hours of sleep without any fluid intake, and with continuous moisture loss through respiration, blood becomes measurably thicker and more viscous by the time the alarm rings. To conceptualize this, imagine your heart as a pump and your blood vessels as pipes. When the fluid flowing through these pipes is thin and flows freely, the pump operates with ease. However, as the fluid thickens, the pump must exert greater effort with each beat. This increased workload not only strains the heart, but also makes the blood more prone to clotting. Research consistently indicates that clotting factors reach their peak activity levels in the early morning hours, making this a primary contributor to the disproportionate number of strokes and heart attacks that occur between 6 a.m. and 10 a.m. It is a perfect storm. The hormonal surge, coupled with thickened blood and stiffened arteries, creates a formidable triple threat for any individual over the age of 60. Fortunately, the solution to mitigating this danger is remarkably simple and accessible. The key lies in consuming a glass of water, preferably at room temperature, before engaging in any other activity. This includes before your morning coffee, before taking any medication, and even before checking your phone. By drinking a glass of water before your feet touch the floor, you begin the process of thinning your blood, thereby reducing the risk of clotting and providing your cardiovascular system with essential hydration to better manage the demands of the day. This is the protective habit identified by the Journal of the American Medical Association research, which demonstrated up to a 62% reduction in early morning cardiac events in adults over 60. The protocol is deceptively straightforward. 1 glass of water consumed either while lying down or sitting before you stand. Yet this simple practice is consistently overlooked or not performed correctly by the vast majority. To further elaborate on this crucial protective measure, I have developed a comprehensive morning protocol designed to safeguard your heart during this vulnerable period. I refer to it as the 90-second heart protocol, as it requires no special equipment, incurs no cost, and takes approximately 90 seconds to complete, offering significant protection to your heart each morning. The protocol begins the moment your alarm sounds. The cardinal rule is to remain perfectly still. Do not move. Instead, take 3 slow, deep breaths, inhaling through your nose and exhaling through your mouth with deliberate and full breaths. This simple act activates the parasympathetic nervous system, the body's calming branch, and begins to counteract the cortisol surge before it reaches its peak. These 3 breaths, which take about 15 seconds, represent one of the most powerful and cost-free cardiovascular protection tools available. This is your essential 25-second intervention, not dramatic, not complicated, but backed by research showing measurable reductions in morning blood pressure spikes in adults over 60. The second crucial step is to drink water before you stand. Tonight, place a full glass of water on your nightstand. Before your feet touch the floor in the morning, drink the entire glass. This is a non-negotiable component of the protocol, and you now understand precisely why. It thins your blood, reduces clotting risk, and ensures your heart has adequately hydrated fluid to work with before the day's demands commence. The third and final step is to sit before you stand. Gently roll to your side, then slowly push yourself up to a seated position on the edge of your bed, allowing your feet to hang. Avoid rushing this transition. Once seated, slowly rotate your ankles in slow circles, 5 times in each direction. This action engages the muscle pump in your calves, which helps to push pooled blood back towards your heart and aids in the gradual restoration of blood pressure. Remain seated for a full 30 seconds before rising slowly, pressing through your legs. After standing, pause for an additional 10 seconds before taking your first step. This completes the entire 90-second heart protocol. 3 breaths, 1 glass of water, and sitting before standing. Implementing this starting tomorrow morning can make a profound difference. For those currently taking a diuretic commonly prescribed as a water pill for blood pressure management, there is an additional critical piece of information to be aware of. Diuretics function by prompting the kidneys to eliminate excess fluid from the body, a process that is both effective and widely utilized. However, in flushing out fluid, these medications also deplete magnesium levels. Magnesium plays a vital role in regulating the electrical signals that govern your heartbeat. A quiet decline in magnesium levels, which occurs in a significant proportion of individuals on long-term diuretic therapy, can lead to electrical instability in the heart. This can manifest as palpitations, erratic rhythms, and arrhythmias, and these issues tend to be most pronounced in the morning, precisely when the heart is already under the greatest physiological stress. Therefore, if you are taking a diuretic, it is highly recommended to ask your doctor to check your magnesium level at your next appointment. This simple 2-minute blood test could provide invaluable information for the health of your heart. Returning to the case of Douglas, after he had stabilized in the recovery room, I met with him and his wife to discuss his morning routine. As anticipated, he described his usual pattern. The alarm would sound, he would immediately move, transitioning directly to a standing position, and heading to the bathroom, a habit he had maintained for 15 years. No one had ever questioned this behavior. While his previous cardiologist had reviewed his medications, diet, and exercise regimen, the critical aspect of the first 25 seconds after waking had never been addressed. Before his discharge, we implemented a single transformative change, placing a glass of water on his nightstand, adopting the 3-breath rule, and sitting on the edge of the bed before standing. 6 months later, during his follow-up appointment, his morning blood pressure readings, which his wife had been diligently tracking at home, showed significant stabilization. The dizziness he had previously attributed to normal aging had vanished. His cardiologist noted the improvement and inquired about the changes he had made. Douglas's simple yet profound answer was, "I stopped standing up fast." He then posed the question, "Why didn't anyone tell me this sooner?" This sentiment, echoed by many patients, highlights the gap in information dissemination. However, the knowledge exists, the research is robust, and the habit itself is cost-free and time-efficient, requiring only 90 seconds. The imperative is to ensure this information reaches those who need it most before it is too late. You are now equipped with this vital knowledge and the opportunity to protect yourself and others. In summary, the morning hours represent the most perilous window for individuals over 60 in terms of cardiovascular health. The surge of cortisol and adrenaline before full wakefulness elevates heart rate, blood pressure, and constricts blood vessels. Simultaneously, blood is at its thickest, arteries are at their stiffest, and the common habit of standing up immediately, performed by Approximately 90% of people without conscious thought introduces a sudden drop in blood pressure that forces an already stressed heart into aggressive compensation. The solution, however, is elegantly simple. 3 deliberate breaths before any movement. 1 glass of water before standing and sitting on the edge of the bed for 30 seconds before rising slowly. This comprises your 90-second heart protocol, a vital regimen to adopt starting tomorrow morning. My request to you today is a straightforward one. Place a glass of water on your nightstand tonight. This one small action will serve as a catalyst, paving the way for the rest of the protocol. Which aspect of this information surprised you the most? Please share your thoughts in the comments section below. I read every single one. If this video has provided you with valuable insights, please consider sharing it. There are undoubtedly individuals in your life who are currently performing the exact same morning routine as Douglas, potentially unaware of the risks involved. This video could be the crucial intervention that reaches them before a critical morning. If you haven't already, please subscribe to the channel. Each week, I deliver honest, research-backed information about the specific needs of the body after the age of 60, offering the guidance I wish every patient had received before they found themselves in my care. Prioritize your heart's well-being. It has tirelessly served you every moment of every day without asking for anything in return. Dedicating just 90 seconds to its care tomorrow morning is a more than equitable exchange. It is important to note that all information shared in this video is intended as general medical knowledge, grounded in published research and clinical experience. It is not a substitute for personalized medical advice. Before implementing any changes to your medications, exercise routine, or morning habits, please consult with your own physician. They possess a comprehensive understanding of your medical history and can best guide your health decisions. Bringing this information to your doctor's attention is precisely how effective and informed medical care begins.